Welcome to Health Professional Radio. I'm the host, Henry Acosta. Joining us today in studio is Tony Holland. Tony is the CEO of OzHelp. OzHelp aims to help people and reach out to the male youth that are working in construction, mining, automotive industries, and other trades. What they do is help improve their mental health and overall well-being. They also deal with suicide prevention, and today we're here to talk about suicide prevention. Hi, Tony. Welcome to the show. Glad to have you on board.
Good morning, and thanks very much for having me. Really appreciate it.
So we'll get started, and can you give us a quick background about who you are and what you do?
OzHelp is a suicide prevention organisation predominantly. We've been around for 14 years now, and we had our roots in the building industry with the death of 3 young apprentices to suicide in 2000. And so we have a really strong focus on early prevention. Our goal is to actually engage with people in workplace settings early to avoid deterioration to crisis and therefore avoiding suicide by actually helping people to manage challenging life situations early and getting the help that they need early to avoid crisis and potentially really serious mental health outcomes or in fact suicide.
What inspired you into starting or making this organization?
This was actually not I've been here for 5.5 years, but the organisation was founded by a lady whose name is Lorraine O'Brien. Her son tragically took his life in 2000, and she was really passionate about trying to do something with apprentices. So our purpose originally, as I said, was to work with apprentices to try and build capacity and give them skills to understand how to manage the changing circumstances of life, things like relationship breakdown and conflict and issues that particularly young blokes find it very difficult to deal with. And so, it was her passion that actually led to some seed funding through the Master Builders Association, the CFMEU, and also the ACT government. And of course, then we've flourished and grown. We're now a national organisation. So it was due to one lady who was tenacious and said, look, this is enough. We can't let this continue any longer.
With regards to your organization, why focus on usually male employees or workers?
Well, men, 75% of all suicides in Australia are men. So that's one of the big issues. And there's a range of reasons for that, partly related to the fact that men don't talk. Men don't necessarily have a good connection with their peer group or with their social environment. And when they become isolated and separated, they then become at greater risk. And so, and blue-collar men often have even poorer coping skills and are a higher risk category than the general population. We work with all workplaces, but our focus really is in those hard-to-reach male-dominated workplaces. So it's because they'll often not be interested in seeking help for themselves. So we're trying to build strong referral pathways for them, make it too easy for them not to get help, if that makes sense.
And let's say I'm someone who's coping with depression right now. How can I reach out to you guys, or what are the ways that I can do to help with that?
Okay, well, the key way that we work is to work in workplaces. So much of our work is on sites. So we work in Western Australia, New South Wales, Northern Territory, and the ACT. We work with companies, and we do a whole range of activities, including physical and mental health screening programs. We do mental health training. We provide support, and we provide counselling, and a range of other activities that actually give people options to be able to get solutions to their problems and then have the capacity to be able to make good decisions for themselves. So it's not only dealing with people who have depression, it's dealing with people who maybe are going through separation or are having financial crisis, or it could be that they're being bullied at work. There's a whole range of reasons why people would engage. But the key to our work is that we actually become the trusted friend, so that when things go wrong, then either the person themselves calls us or someone else that they know calls us about one of their friends. And so therefore we start the conversation, and sometimes it's as simple as just a chat. That's all they need, is to just have a simple chat with someone to talk through some issues, and often then they'll be fine. Other times they may need to be referred on to counselling or even into psychology or even psychiatry. But a lot of times those more high-end interventions aren't required when people are given a safe place to be able to have a chat.
What's the biggest misconception that people think when they hear about mental health and suicide prevention?
They're scared. They think that they can't do anything about it. They think that they're going to make it worse if they talk about it, and all of those things are not true. It's the best thing you do is to actually talk to people, ask them how they're feeling, and just by talking to people and ask them how they're travelling, whether they can actually provide some support for them. You don't have to fix their problems. You know, the average punter on the street doesn't have to be a counsellor, but just by asking someone how they're feeling, whether they can actually be a support to them, whether they can actually just listen to them, that can save lives. We know from our work that does save lives. So, you know, I think to get over the fact that, you know, it's not going to make it worse by asking people how they're feeling. The worst thing they can do is say, leave me alone, you know. And generally they won't say that. Generally they'll be really appreciative of the fact that somebody cares. So that's the big message, you know, take some time to actually care, take some time to think, and then refer them on to people like us or other services that are there to actually really provide the support that they need, but just not feeling as though they're alone. I think, you know, having that sense that I'm not alone in this, I've got someone who actually takes a bit of time to think about what I'm going through. And that'll save a life. And it's not rocket science. You don't have to be a mental health professional to save a life.
And for our audience who's listening right now, what is the main takeaway message that you want them to know and hear?
The main takeaway message is that suicide is preventable. It's a massive statistic. Over 3,000 people a year die by suicide. And that's a national disgrace. We need to do something. We need to do more to reduce that. And so the key thing that I would like to say is that take time to actually listen to people. Take time to care about people. Smile and find ways to actually engage with people in a real way day to day. If every single person who's listening to this takes the time to actually smile or ask someone how they're travelling, or take time to chat to their neighbour over the back fence or their work colleague who they know is probably not quite themselves at the moment, just take time and actually see how they're travelling, I guarantee you that will make a difference if we all did that. So that's probably the number one message. The number two message is to men, is that don't wait. There is lots of help available, you know, whether it's physical health or mental health. The best thing to do is actually to ask some questions and get some support for yourself. It's never going to be better if you do nothing about it, you know. Most blokes will fix their cars, they'll maintain their house, they'll plan their holiday, but they won't do anything about looking after their physical and mental health. The best thing you do is to be proactive. Take the time, understand your body, understand how you're feeling, and actually get to see your doctor and build a wellness journey for yourself. Those two things alone will dramatically impact on how people are feeling.
And what are the ways that people can do to reach out to you guys and talk to you guys?
Okay, 1300 OzHelp is the simplest way. Where that's a national number. We can be received from anywhere in Australia, and we also have a quite informative website, ozhelp.org.au, and also to info@ozhelp.org.au. That's ozhelp.org.au. We're always happy to talk to people. We're keen to build relationships across Australia. We've got all sorts of programs and services that could be potentially a benefit to workplaces around the country, and we'd love to hear from people.
Well, that's all our questions for today. Thank you for being on the show, Tony.
My pleasure. Thanks very much for your time. Have a great day.
You too. And that was Tony Holland, the CEO of OzHelp. OzHelp is an organization that seeks out to men who are in need of help with their mental health and overall well-being. I'm Henry Acosta, and you've listened to another segment at Health Professional Radio. To listen to this interview, catch us on www.healthprofessionalradio.com.au and at hpr.fm. You can also find us on SoundCloud and iTunes. And thank you for that, Tony. We appreciate it.